Quandra Nesbitt, Chief Technology Officer Lindsay Parker, and Director Chris Rodriguez. And we will provide a brief update on our response to COVID-19 in the District of Columbia, and then we will take questions. Let me start. What do you need? Let me start by outlining the metrics that we report each day at coronavirus.dc.gov. We mentioned, and Dr. Nesbitt will be available for any questions you have about the district's experience. We, of course, continue to follow very closely all of them, and especially any metric that shows up in red. The daily case rate that we average on a 7-day, that is a 7-day average, has gone up and down a little over the last couple of weeks, and we continue to watch and hope that it goes down. Among other things, our metrics follow our health systems capacity, our public health system capacity, and the level of community engagement with our intervention efforts. So again, you can watch that at coronavirus.dc.gov. We also display our vaccine distribution numbers, including how many we have received, how many have been administered according to our system. There is some lag in those numbers, as well as the number of DC residents that have been who have received first doses and are fully vaccinated. So please check that. I'm happy to report that the number of doses that we are receiving is going up. Still, we know that our system can accommodate many, many, many more doses, so we continue to advocate for the district receiving more doses. And we briefly note how we are distributing for this week those 24,000 doses. The lion's share going to vaccinate.dc.gov, and we'll say a little bit more about that later. Just over 7,200 going to DC health centers, and just over 2,800 going to special initiatives that we have talked about before to make sure that our vulnerable populations are being vaccinated. Last week, we also talked about a new pre-registration system for making vaccination appointments, and we're going to say a little bit more about that. We are migrating from a system where residents and DC workers are asked to go all at the same time to a site or a phone call at the same time on Thursday or Friday. To a system where we're asking you to pre-register. You will include your identifying information, medical history, and the like to pre-register so the system can assign an appointment to you when it's your turn. And here you can see the operating principles for how the system works. It's focused on an equitable distribution, getting the vaccines to those who need it the most first, consistent scheduling cadence, and a shared responsibility to pre-register people. And here is how we're going to make equity a top priority. And I know rightly there are a lot of questions about once you pre-register, then how the system will assign an appointment to you. We talked about this some last week, so let's go into some detail. Half of the appointments will be reserved for DC residents living in priority zip codes. The overall breakdown, which you can see in this chart, at least here's the overall breakdown. 40% of appointments will go to DC residents who are 65 or older, and half of those are going to seniors who live in priority zip codes. 40% of appointments will go to DC residents who are 18 years old to 64 years old with qualifying medical conditions. And again, half of those will go to residents who live in priority zip codes. and 20% of appointments will go to eligible workers. And again, half of those will go to residents who live in priority zip codes. At this time, the order in which you register does not affect the order in which you will be offered an invitation, although we foresee that the randomization process that will be used initially may be adjusted to ensure that individuals are not passed over week after week by those with similar risk factors who more recently registered. Last week as well, CTO Parker also showed us some examples of what the registration system will look like, and now we want to set some general expectations. So beginning this Wednesday, March the 10th, you will be able to submit your information through the pre-registration site or by calling the district's call center. Again, the website is vaccinate.dc.gov. And the call center is 855-363-0333. And again, you will be asked to include information about yourself, your occupation, your medical history, your COVID-19 history, and your contact information. So it's always a good idea to have any information related to that handy for when you call. The call center hours are Monday through Friday, 8 a.m. to 7 p.m., and Saturday and Sunday from 8 a.m. To 4 p.m. And after you register, you will wait. You will wait to get a call, text, or email, your choice, telling you that it's time to make a vaccination appointment. This could take days, it could take weeks, and it can even take months, depending on your risk factor and eligibility. We do not currently have weekly enough vaccine for everybody who wants it. So logic tells us all that when people sign up this week, we won't have enough vaccine for everybody who wants it, and that will remain the case for weeks and months. So we will have your information. We will be able to assign it according to the eligible people and workers that the district is vaccinating, and according to the factors that I just explained. Then once the invitations go out, you have 48 hours to book an appointment, and each invitation can only be used once. If you're registering on someone else's behalf, we request that you and that person get an alert. Only one person will be able to book an appointment. And the invitations can only be used for the persons whose name and information was submitted via the registration system. Of course, once you get your invitation, you should book your appointment and then keep your appointment. Go and get vaccinated. You might ask what happens if you miss the 48-hour window, and I want to explain why we're setting that, because that is helping to make sure that the available vaccine is being used and not wasted. We need this time limit in place so that we know how many appointments are available and we can schedule it properly and prevent vaccine waste. If you miss the 48-hour window to book your appointment, then your name will go back in the pre-registration list, and you will wait until the next time you are selected by the system. The system will select people up to 3 times. If a person does not respond after the 3rd time, they will need to re-register. So let's just review quickly the timeline for the first week. And I say for the first week because we will get into a different cadence in following weeks. Wednesday, March 10th, pre-registration opens. Friday, March 12th, the first invitations to make an appointment go out via calls, text, and emails. March 15th, the first vaccination appointments made through the pre-registration system take place. And if necessary, a second set of invitations go out via calls, texts, and emails to ensure that all of this week's supply are being used. Now, that was the first week, as I mentioned, and after the initial launch, there will be this cadence. Thursdays by 10 a.m., invitations will be sent out, as well as Sundays by 10 a.m., and Tuesdays by 10 a.m. only if any appointments need to be filled. So we're asking everyone who is registered in the system on these days to check your spam folder to make sure you're not missing any email alerts from us. And again, you have 48 hours to schedule your appointment. So that's what people can expect with the pre-registration system. And none of this will work if people who are eligible aren't in the system. So we need people to go and get signed up, and we don't need to take our foot off the gas and focusing on more vulnerable communities and focusing on people who need more tech assistance or call assistance or reminders or more information. So we all have to be focused if we want an equitable distribution of the vaccine to make sure that people are getting registered. Doesn't have to be a mad rush, as we have the feedback we've gotten on Thursdays and Fridays that there's more time to register, but we need you to get registered. So let me be clear about who we're asking to register this week. We want people who are currently eligible to register. And because of the randomized selection of individuals, there will be no benefit to being the first person on Wednesday to register. So there's no need to scramble to be first. But if you are in the eligibility criteria, then we want you to get registered, and that includes all teachers and staff of schools and licensed child care facilities in DC to pre-register this week. So let me spend some time talking about who is now eligible. And if you haven't received your vaccine and you're on this list, we want you to go to the site on Wednesday to sign up. Individuals who work in healthcare settings, members of the fire and emergency medical service, residents of long-term and intermediate care facilities, DC residents who are 65 years or older, individuals experiencing homelessness, members of the Metropolitan Police Department, Department of Corrections employees and residents, continuity of government operations personnel, all teachers, as I mentioned, and staff in a licensed DC child care facility, grocery store workers, outreach workers who work in health, human, and social services, individuals working in manufacturing, working in food packaging, and DC residents with qualifying medical conditions. Some of the populations are in our special initiatives, as I mentioned, and may be contacted directly by a vaccinator, but most that I have mentioned are should go to vaccinate.dc.gov to register. So we, of course, have our Senior Vaccine Buddy program, but everyone who has a senior in their life should feel empowered to be a Senior Vaccine Buddy. Call that senior, let them know about the pre-registration process, help that person sign up through the call center or by going online so that we can make sure that they're registered. That said, we also want all veterans in DC to know that they may also get vaccinated through the VA Medical Center, and you can find out more by going to va.gov or 202-745-4342. I, of course, mention that because it expands the number of doses in DC, and DC residents who have served should feel welcome to visit the VA, to, of course, visit with their medical providers if necessary, but also to get vaccinated. And finally, last week we recognized Women's History Month, and today we want to recognize the International Women's Day. So call all the fantastic women in your life to ask them what's their plan to get vaccinated, and that would be a great way to celebrate the International Day of the Woman. So with that, we'll take your questions. Yes, Sam.
Yes, for Dr. Nesbitt, a question. How do you prove if you got one of these conditions that is considered acceptable? I got a call about that this morning. That's why I'm curious. How do you prove that, say, you're a diabetic or something to the people at the place?
So our goal is not to create artificial barriers to vaccination. So when an individual registers, they have the opportunity to complete their employee status, or if they're going under eligible workforce, and we have the full list of eligible chronic conditions for the district also on the website, and the individual selects yes or no as a form of attestation.
So just saying it means you're accepted, is that?
That is correct. It's through the registration process.
Because one of the other things she said that once she wrote she was 50-something, she just automatically got knocked off the system. Does that happen?
It does not. It depends on when the individual signed up. So if we were only vaccinating people 65 and older, then they may have not been able to move through the system. However, there has been for several weeks an opportunity for certain eligible workforce folks to document that as well. So if you were, prior to us activating 18 to 64-year-olds a couple of weeks ago, if you were 50 years old, not an eligible workforce person, you would not be able to proceed to make an appointment.
But at this point, you can.
Well, let's be clear. I'm glad you're asking this. We want to ensure that individuals right now who are registering are in an eligible category. So, we have individuals who are over 65, regardless of their health status, who are DC residents, individuals 18 to 64 who are DC residents with an eligible condition, and then select workforce folks for essential workers who can register regardless of their status as a DC resident or non-DC resident, as long as they work in the district. So with that focus, if people meet those criteria, we want them to sign up to be vaccinated. If you're 18 to 64 without a qualifying medical condition and you're not one of the members of the eligible workforce, if you register, we will have your information, but you will not be selected until we get to your eligibility group. So our goal right now is to have as many people who are eligible for vaccination sign up to pre-register so that we can turn those appointments around rather quickly without people being frustrated. If you sign up this week and you're not yet in the eligible criteria, you may feel as if it's taking weeks or months for you to be selected because your group is not yet eligible. I hope that is helpful for folks. So if you're general public and you go on right now to register, that's not going to make you get vaccinated any faster. We have to actually make the group eligible.
Yes, Michael.
So following up on that, is that the primary reason why you're not asking everyone to make or pre-register right now, is because you don't want people to get frustrated, or would that present some type of problem?
It's a combination of both. I think that, for folks who get into the pre-registration system and would have optimism that they're going to be vaccinated within 2 weeks or 3 weeks, even if they're not in an eligible group, we want to make that very clear that we are still only selecting through the pre-registration process individuals who are eligible. So even if you go on to sign on, we would not select you for vaccination yet.
Right, but that wouldn't present a problem for the system or anything like that if people who are not eligible yet go and do it anyway?
Well, what we don't want is everyone to rush to the website at one time. That's the process. That's the reason for establishing a pre-registration system. There's no advantage to a person registering now who's not eligible.
Okay, and I guess following up on that point, at last week's council hearing, the assistant city administrator said there wasn't a decision yet on who the vendor was going to be for this pre-registration system. Then the following day, we were told that it was going to be Microsoft. So can we get some clarity on exactly when the decision was made on who the vendor would be for the pre-registration system?
Sure. We're making a number of different solutions right now, right? There's a lot of different technology solutions that are being created to address COVID-specific problems. And we never want to be in a position where we're only moving forward with one solution, and then we get to the end of the line and that solution doesn't cut it. So it's not a problem to pursue working with vendors that we've worked with to build the contact tracing solution, as well as vendors that we use to build out the mass testing solution, so that we could get here this week and have a system that's ready to go. And that's what we did.
So can you specify when the decision was made that you will be going with Microsoft over another solution?
We made the decision when it was the right time to release the pre-registration system, which we're doing this week.
Okay, it's just because on Thursday night there was no decision made, and then Friday there was. So was it sometime between that time frame? That's just the part I'm trying to figure out.
Yes, between that time frame.
Okay, thanks. And then Dr. Nesbitt had alluded to people not wanting people to rush to the site to pre-register on Wednesday. So are there concerns that the system could be overloaded with a capacity issue again?
Anytime there are a number of people hitting one website at the exact same time, right, which is what we've seen for the past few weeks, Thursdays and Fridays at 9 a.m., a spike of, call it 200,000 people hitting the site at the exact same time, pressing refresh from multiple different devices, you're always going to have a slight lag where you're going to need to ensure that that load on the system is able to be balanced accordingly, right? So what we're hoping to do with this pre-registration system is flatten that spike, right? So we don't have those spikes happening at 9 a.m., for instance, Thursday and Friday going forward. Right. That's what we're trying to do here.
Yeah, okay, and just one more follow-up on that, because on Friday what we saw is, things looked smoothly on Thursday. Then Friday, I got a bunch of emails and tweets from people who were frustrated because the site opened, I guess it was 6 minutes late, because there was a capacity issue, and that was the reason that was cited, even though the night before it seemed like you were pretty confident that wouldn't happen again.
So the actual portal worked fine, right? The actual portal, the Microsoft portal, worked as it was expected to work. What happened, however, was we got an even greater amount of people than we'd seen prior on our website, dc.gov, heading into the portal. And that's what caused, again, same thing, right? Massive spike in user traffic. All of a sudden, the web hosting solution that we utilize had to spread the load over multiple servers. That took 5 minutes for those servers to kind of spread that load accordingly, and then pushed everybody to the Microsoft solution. So similar, right? That's sort of what we're trying to do by introducing the pre-registration system, flatten that user traffic.
I guess my question then is just why should residents who've maybe now tried 5 or 6 times and failed feel confident that this pre-registration system will actually work?
Michael, let me, that person is still not going to necessarily have a vaccine after they pre-register. So if your question is, if a resident went to the website to get a vaccine that day and didn't get it, when we had 5,000 appointments available and 30,000 people trying to get it, that's not going to change with the pre-registration system. People are still going to have to wait until the amount of vaccine that we have matches the number of people that we need. Is that your question?
Well, my question is more so on the fact that the technology has not worked as expected for a few weeks now, and we're introducing a new system now. So why should people feel confident that
what we can tell people is that we're doing the best we can to make the technology match the very high demand. And what we're also doing is hopefully ensuring that they won't have to encounter it week after week. So if you're asking me this week, is there not going to be a 6-minute delay? Is there not going to be any I can't tell you that. But I can tell you that we're putting together a solution and we're asking people to follow what we've asked, that not everybody try to go on at the same time, because that's not going to put them at the head of the line. If you're not eligible, not to do it. I think if we do all of those things, that we're in a good position to have a good experience on Thursday. Can I tell you that I'm not going to come back and say there's something? Hopefully not. Hopefully not. But one thing I know is that if we find something that doesn't work exactly right, we'll fix it. But this system is meant for you to have that frustration once, not week after week. Okay? Yes, sir.
Two questions. Dr. Nesbitt, I was speaking with a lady, she's 60 years old, and she's hesitant to get the vaccine because and this is what she said, I have not been tested for COVID. My first question is, do you have to have a test for COVID in order to get a vaccine, to clarify that? The second is, what manner do you have in terms of the homeless? Many of the homeless are not engaged publicly. So how are you reaching out to the homeless to see that they're getting vaccinated?
So I'll start with your second question. As many of you all know, the district has had a health care for the homeless program for a very long time. And we have been working very closely with the Department of Human Services and Unity Healthcare, which is the provider or the operator of that program, to vaccinate individuals who are experiencing homelessness and who have transitional housing. And that program has had, by the number of people who are rostered or who are considered to be documented as experiencing homelessness, close to 50%, if not more, of those individuals have received their first dose of vaccine. So there's aggressive outreach. I'm sure you all know that we have street teams that work through the Department of Human Services and many of our other service providers to ensure that these individuals know about their ability to get vaccinated. And the vaccine clinics have been rotating through the low barrier shelter system to ensure that they have access at a place that is familiar. As to your first question, you do not need a test for COVID-19 or to be tested for, and that means a diagnostic test like the PCR or antigen test with the swab in your nose or the use of saliva. You don't need that test, nor do you need a test for antibodies, the blood test. None of those are required for an individual to be vaccinated against COVID-19. Everyone should get vaccinated for COVID-19, regardless of their history of having COVID-19 or not.
Yes, ma'am.
Mayor Bowser, and also I haven't talked to you since, so my condolences
Thank
to
you.
you and your family. I want to ask about, the technology portion of this and the fact that just days before the system was set to launch, that there was still not a selected vendor. The fact that that is the case, what does that say about the vaccination effort in the nation's capital?
I think that the CTO has already addressed that question, Stephanie, and I think, quite frankly, we wanted to put ourselves in the position to have the best product, and when we were assured of that, we made a decision. I don't know that is too unusual in the technology space. And if you're more broadly asking about how the vaccination process is moving in the district, we can go back to those slides to talk about how we have a focus on equity and getting the vaccine out in a number of ways through a centralized system, but also to healthcare providers who are familiar with their patients and their communities, which is important, and some special population initiatives. Let's be really clear about the disparate impact of this virus on our community. I think certainly nationwide, and we feel it acutely here, that this virus hasn't affected everyone the same way. That the prevalence of the virus is affecting Black and brown communities, and the fatality of this virus is particularly hitting African Americans. So we have an obligation to make sure that we have a system that is working for fighting this virus where it has hit us. And we, as I mentioned at the outset, can deliver with this system more vaccine. And we're heartened that federally, the Biden administration is pumping more vaccine across the states. We think that we should have a different allotment for our federal workers, our essential federal in-person workers, and so we don't agree with that decision, but we're continuing to push on all fronts.
follow-up, since you mentioned Biden, the administration. I saw your tweet recently talking about the $755 million for funds for DC. Is there already a plan of what to do with that money?
Well, thank you for mentioning that. I should have really mentioned that at the top, because that is really big. We've been fighting, I guess now, I don't remember when CARES came out now, maybe since last May, on the unprecedented and unequal treatment that the district received in CARES. We've worked very hard. My federal and regional affairs, led by Beverly Perry and her team, with the administration and with the Congress, and of course our Congresswoman has worked extremely hard. But I have to say, the commitment from President Biden, making it clear to Senate Democrats this priority. Our Speaker of the House has always been staunchly in our favor with all of our Democratic delegation. So we're grateful to them for making the district whole. As far as our budgeting process for that, yes, my team, in our budget team, is really looking at how we can make sure that those funds are invested in the relief kind of portion of where we are with this pandemic. That's for workers who have lost jobs, businesses who have lost business and had to shutter, and that's for our students who we have to accelerate their experience so they're making up for time lost in school. But it's also for how we invest in the future, how we bring jobs back, bring our downtown alive again, and build and create more and a stronger economy in our city. Yes, Mark.
I had two questions. One, if I could just follow up on Stephanie's, and I don't even know if this is allowed or possible, but is it possible, since you've been complaining about the allotment of doses, can the district simply circumvent the federal government and go directly to the manufacturers and buy their own vaccines? Is that something that's possible or that's being
I don't
considered?
think it's possible, and it probably doesn't make a lot of sense, because then it would be the wild, wild west of localities going it on their own. And we saw what that was like when we were all scrambling for PPE. It doesn't make a lot of sense. It drives up the prices and it leads to inefficient decisions. But I do think that the central decision making can accommodate when you have a outsized worker population like we do.
And if I could ask about the pre-registration process for whoever's best to answer this question. One, can you clarify, if somebody is not eligible, will they still be able to register come Wednesday?
They will be.
They will be?
Yes.
But you're discouraging them not to?
I am.
Or you're encouraging them not to?
I'm encouraging to wait until their eligibility phase is announced.
And is there a reason why you just didn't put a block on that so that they couldn't?
I think it would just amount to a lot of confusion and frustration.
And then the link, we've seen this in other jurisdictions where they send out a link and then I get a link and then I share it with all my friends and then everybody ends up disappointed. So what are you doing to kind of circumvent that from happening once you start sending out those links?
So I know Director Parker is going to speak to the specific technology, but I also think it's helpful for people to know that a lot of times when people are saying sending a link, it goes out as a link to an eligible group of individuals, and they send that link on to other people. So for example, with our continuity of operations folks or our fire and EMS personnel, they all get vaccinated at the same place. We don't pick the day that they go, they schedule themselves. So there are active links for those workforce folks to sign up. Those are more often misused than the one that CTO Parker will tell you about, which is specific to an individual and is connected to their actual personal information.
And more specifically, that person, when they receive that email, that phone call, that they're invited to actually book, they can book one appointment with that link, and then the link is no longer usable.
Thank you.
Yes, sir. Michael.
So I guess I had one quick question about, we saw the percentage breakdown of portal appointments for this week.
We can go back to that slide.
Yeah, is this something that we're going to get weekly, bi-weekly, or when they open up new categories for who's going to receive the vaccine?
Yes, I will come back to you with the cadence of when we can report that, but I expect that we'll look at the portal to see how many people are registered who are 65 and older, for example, and then how many appointments are going to be going out to that group each week.
Okay, and then is that something that people who are not watching your press briefing will be able to see if they go to the vaccine portal?
Yes.
Okay.
I'm sure we'll find a place for it on the portal.
Okay, thank you. And then, not related to pre-registration, I was just looking at the latest breakdowns today of where people are getting the vaccine in DC on a ward level. And this might be a good one for you, Dr. Nesbitt, but we're still seeing similar disparities in terms of which populations in the city have received the vaccine than we were a few weeks ago. So my question is, are the interventions that you've put in place, vaccine buddies, the priority zip codes, the public housing vaccination clinics, are those working as effectively as you'd like them to be?
They are working. I want to clarify your statement. Our data doesn't show where people are being vaccinated. It shows who is being vaccinated by their ward of residence, which is a different thing. And part of the conversations that we've had and why I want to take this opportunity to really stress what the mayor said about assisting people with registering if you know someone who is eligible to register. The largest proportion of our sites for people to be vaccinated right now are in those wards that have the lower vaccination rates. And so we've designed some special initiatives, as you all know, in terms of doing the partnership with Sibley and the Housing Authority. 55% of those were done in our priority zip codes, as well as the Senior Vaccine Buddies program, which aggressively goes, and I use aggressively as a nice word, into our high priority zip codes in wards 7 and 8 at this point, to make sure people understand their eligibility for vaccination. What I want to really ask for people to do is if you know someone who wants to get vaccinated, get them registered. They will be selected based on our equity focus. What I would want to not have is for people to be waiting for a special initiative to reach them if they can get to one of the various community sites that are located in their community. So we know that UMC, over 50% of the vaccines that they've given have gone to residents in wards 7 and 8. We also know that some healthcare providers like Sibley, 50% of the vaccines they've offered have gone to patients in Ward 3. So those are the types of things that we continue to adjust the system to ensure that there is equitable access.
Thank you. And then one follow-up on Mark's question on the links. Has that been an issue in DC in terms of people sharing links with those who are not currently in the eligible groups? We've seen that in Maryland, but is that?
It has not been a widespread issue. We had 1 week where one of the links for a workforce was shared, but there was an ability to validate that workforce because all of them have the same identification. But we have not seen that happen because we don't overly use that approach.
Thank you.
Yes, Sam?
Mayor, I have a stimulus question. Can this money be used for budget shortfall? I mean, I think the city fell somewhat short this year because of efforts for COVID. Can this stimulus money that you're getting fix that?
We will look if it is like CARES, and I haven't gotten the complete download on the rules around this, and it's not completely approved yet. I think the House will vote on it tomorrow. If it is like CARES, there are some limits on what it can be used for. But we were able to use the CARES funding to help with some of our operational needs. And so there could be limits on the type of expenditures and the duration of those expenditures. So there's probably a deadline.
But that's something you're looking at, obviously.
Absolutely. Yeah, I can't actually see you, but can you introduce yourself?
Yeah, Sarah Payne from the Hill Rag.
Okay,
I had a
Sarah.
question about MPD.
Okay.
So will the MPD shift from arrest to citation and the enforcement of misdemeanors continue after the pandemic is over?
Will the NPD shift to,
From arrest to citation, will that continue?
for
after?
what?
For the like policing, will that shift change? Will it go back to what it was pre-pandemic? Or will will
I
that
think
change
that there are a number of things that MPD has found has worked during the pandemic, specifically related to the courts. I'm not able to tick them off the top of my head, but the chief could answer that question. And so and I don't know what particular violations you're talking about, but MPD has a number of tactics that they can use to divert people from the courts. And so I would expect that they would examine them closely. Yes.
3 questions. First for Dr. Nesbitt. So, we've seen metrics drastically drop in the area. I understand daily case rate is still in red. But once daily case rate turns yellow, how long before you see, are we still looking at 2 weeks? How long do you see before the area is starting to move into a different phase?
How long am I doing what?
How long do you see DC, waiting in this phase before going to another phase and reopening more?
Sure. So if you're actually looking at your trend charts that we have online, one of the things that you'll notice, and the reason why we created the ranges for all of the metrics we have, is that it tells us something about whether or not the virus is contained or if it's still spreading substantially in our community. And we can assess the amount of resources that are available and required to respond to COVID-19 at a high level of spread or substantial amount of spread compared to containment. You will note that the red, while we had a deceleration from the peak in January, it is still not as low as we have ever been in the district. And I think that's important for people to understand. You may also be familiar with the discussions that we've had around what could potentially drive our numbers back up, which is still a lot of unknowns about the variants of concern. They all have higher rates of transmission than the strains that were present in our community back in the summer, and even as we began to head into the holiday season around Halloween. So we have, as the mayor mentioned at the very beginning, we had a bit of deceleration or decrease in our cases through February, and now we've sort of plateaued at this level. We don't know if that plateau is going to stay there and then drop down, or if it's going to stay there and then go back up. And so our goal is to be able to have some period of observation to be able to observe that. But I do want to emphasize that while the U.S. has had a deceleration, this region has had a deceleration, we are not yet back to where we were before the holidays.
And follow-up, please. This is on another question. This is in regards, well, 2 more actually, but in regards to the trial selection starting today for George Floyd, has the city discussed whether there may need to be some preparations taken, whether the trial ends one way or another?
Yes, we have. That's something that MPD and Homeland Security are monitoring very closely.
Are we looking at, another situation where the city has to board up again? Can you share a little bit of some of the conversations being had?
Well, the city has never, you've never heard me say everybody board up. That's not something that we're likely to recommend. But we will continue to monitor activity and make sure if we have First Amendment demonstrations that they can be conducted safely.
And then the other question I wanted to ask has to do with, I don't know if you got a chance to take a look at it, but there was just a report that came out right before this meeting started about new CDC guidance. And while the CDC is encouraging vaccinated people to continue to social distance and mask, it also says that fully vaccinated people would be able to gather indoor without doing, social distancing measures, without wearing a mask. Speaking to that, has there been any kind of conversation on moving forward whether businesses will be allowed to make those decisions on whether they have people vaccinated, or will this continue to be the city regulating who is allowed to enter once things start to open up? And in addition to that, moving forward, are there going to be any changes to Nats Park allowing fans? We know today Wrigley announced that they're going to allow, I think, 20%. indoors?
Well, can I start?
She
Let me,
started wrong.
okay.
She phrased the thing, it's not completely accurate.
Okay, but let me just start. So you asked a lot of questions. Let me see if I can start. First, we're watching the data. While we're confident, DC Health continues to watch the variant and the impact it has in the city. We want to look at all of our interventions. Dr. Nesbitt asked me to look towards the middle of March. I think the scientific information is suggesting we will have a better understanding of how this variant is moving through the city and the region. So that's what we are looking to for all of our interventions, kind of things that are in level 2 to see if we can open it up more in phase 2. So that includes our sporting venues and other business things. So our expectation is that we'll have some loosening now and even more later. Yes, sir. And I think you may have the last question. Oh, second to last question.
Okay. Mayor Bowser, this is off topic.
Okay.
There's a bill filed by Councilmember Christina Henderson on ranked choice voting. Could you articulate your thoughts about this system, which some people should believe should replace the electoral system that's present in the city right now?
I can't right now. I would like to look at her bill, which I haven't. I know something about ranked choice voting. It's something. It's kind of like all the questions you're asking me about how pre-registration will work. That's how I feel people will be about ranked choice voting. It will take some investigation to figure out who you voted for. But let me look at it. I want to look at her bill and look at the experience some other places have had who have it. But you know, I've worked with the system we have for a long time, so I've got elected a lot of times. So it works pretty well if you ask me. Okay. Yes, Mark.
If I could, I guess for Dr. Nesbitt, two questions. One, are you able to give us any wastage numbers yet on doses wastage? And then I'm also wondering, the mayor mentioned tracking the variant. Can you update us? Dr. Shaw said recently that he expected in the coming months the majority of new cases would probably be variant cases. Can you put any meat on those bones for us today?
Sure. I do not have the file with waste data with me, but we do share that, so we can get that to you. The vast majority of it happened in the first couple weeks of the program as folks became familiar with the vaccine and more efficient and accurate scheduling. In terms of the variant, there are variants of concern, B.1.1.1.7, which originated in the UK, B.1.351, which originated in South Africa, and then P.1, which originated in Brazil. And there are now some additional variants of concern that have originated in the United States, both in New York and in California. We do learn more about these variants over time in terms of their ability to increase the rate of transmission. So the more dominant that it becomes in your community or jurisdiction, the faster your cases will increase, or the doubling rate. You might remember that metric from a long time ago. And we still look at it internally, but we don't share it as much because our doubling days are very high in the district. But that can all be compromised if you introduce these variants of concern being a higher proportion of your cases than you had before. We have, as you all know, detected cases of B.1.1.1.7 in the district. We have detected a case of B.1.351 in the district, and a case of P.1 was detected in a Maryland resident who we understand did not necessarily have a history of travel. When these cases occur and they're occurring in individuals without a history of travel, it indicates that it is present and prevalent in the community. I've also shared with you that not every positive test is sequenced for these variants, and so what we look at is what proportion of the tests that are sequenced over time test positive, or where these variants of concern are actually detected. And we have seen more of the B117 cases in the district with subsequent sequencing.
Can you tell us the percentage? Is it now outweighing the original?
It's not yet 50%, but it's important to remember that it's just a sampling of cases. It is not all cases, but the proportion of those that are sequenced is increasing.
Okay, last question.
So my understanding is that DC Health wants to use the pre-registration to be able to see which neighborhoods it might need to target. For example, if numbers are really low in one neighborhood and you're not getting a lot of people who are pre-registering, you might need to focus, for example, vaccine buddy initiatives or whatever in those neighborhoods. This is what I heard last week from Dr. Shah. So I'm wondering, will there be a point where you tell the general population, hey, you should go pre-register now, or people who are not currently eligible now, hey, you should go pre-register now? So you're actually getting that data and seeing where people are pre-registering?
I want to make sure we don't conflate and confuse goals and objectives here. So we have the ability, as you would say, through the pre-registration system to see where people live in the city or who's registered that's a non-DC resident, and that gives us some sense of where folks are. That notwithstanding, we already have data where individuals who are 65 and older have been eligible since January 11th, and the enrollment in that vaccination effort was not equal across the district, right? We had some inequity there. And then we designed other initiatives. So we don't need people to jump into the pre-registration system who are members of the general public, less than 65 years old, no qualifying health conditions, not an essential worker, to go into the system in order for us to be able to understand where additional efforts would need to occur. You're also familiar with our special initiatives, Faith in Vaccines, the housing partnership, senior buddies, all of those are already in those communities to do two things. One, increase awareness about eligibility for individuals who are already eligible, may not know that they are eligible, may have questions like James asked about whether or not they need to have a COVID-19 test before they get vaccinated. And then two, to be able to continue to do education around the vaccine for those who will have some degree of hesitancy. It's our understanding and belief that there is still demand across all 8 wards, which is why we're committed to the equitable distribution through the pre-registration program.
Okay.
Thank you.
Thank you, everybody.